I always enjoy doing this. It's very important information to share, and it's important information that people are familiar with it. Particularly, as we get on with the start of the school year, it's going to be a busy time, and this is something that really is important that individuals and families, stakeholders, advocates, and school personnel keep track of. We have a lot to cover in a very short amount of time, so I'm just going to go ahead. As Jackie mentioned, questions in the chat, please. And time at the end, I will answer as many as I can. My contact information will be at the end as well, so you can always contact me there. And just for reference, I do not discuss personal cases for time and also for privacy issues. But if anybody has any technical questions regarding the material I'm going to cover, I'd like to be able to cover those things. So if you give me a minute, I'm going to share my screen and get started. Okay, can people see that? Okay. It's not going to let me expand, so I'm just going to cover that part of it there. Keep it like that. Okay. Again, we're just going to go over the very high level technical pieces of the Chapter 688 Turning 22 process. I'm going to talk about a little bit about 504 plans. You're probably wondering what 504 plans have to do with special education and 688, but this is regarding DDS, along with funding for Turning 22, which DDS is very, very fortunate to be able to have. Okay, the Chapter 68 process. I trust people have heard of this or know of it. This is probably the first time you've heard of it. It might even be the 10th time you heard of it. But what I've heard from many family members is that no matter how often they hear this, they always pick up on something new or drive something else that they need to keep track of. So it's always important to stay on top of this and to continue to be as familiar with this as you can, because it's very, very important, and you're going to find out pretty soon. Turning 22, people leaving special education, entering adult services. There's a lot involved in that. The fiscal, programmatic, what's going to happen during the day, what type of support they're going to need at their home, or if they're living on their own, they're living in a program. Not just 22, 23, 24, when you're eligible for DDS, you're eligible for life. So, what's going to happen, not just next year when they turn 22 or 5 years when they turn 22, what's going to happen 20 years from now, 25, 30. So those are just some of the things. Again, I don't want to lay it all on you now. Okay. It's plenty of time to look at this stuff, but it's a very important step. Just like everything else, just like your own individual retirement planning or anything like that, you just have to think ahead and look ahead. And it's important to know, be familiar with this. Also, too, I can assure you that at some point in time during this presentation, you're going to think, so-and-so should have been here. Or you know what? So-and-so I was asking about that last week and they should have been here, whatever. So again, all the information that I'm going to cover with you today is on the DDS website. And the link is at the end of this, but it's very simply mass.gov/DDS. So everything I'm going to discuss with you today is on there. And like I mentioned, again, DDS is very fortunate to have specific Turning 22 funding. We're about the only state agency that has that, and it's in the millions. But it doesn't cover everything, but it covers a lot, and we're very, very fortunate, and we're very thankful. Governor Baker and now Governor Healy, they both recognize the importance of the transition Turning 22 funding for DDS. And they're both budget presentations when they lay out the budget for the fiscal year for the Commonwealth. Both Governors Baker and Healy have always highlighted the transition funding for DDS. It took a lot of work. Being up on the Hill, talking to many legislators, the importance of Turning 22, but we're very fortunate to have that, and we're very, very lucky that the legislators have always supported that. they get turning 22, which is, we're very, very lucky, and very lucky to have that here in the Commonwealth. I tell you, I get 2 or 3 calls a month from families from other states in the country, and they hear about Massachusetts and what we offer, because they say that their loved one is going to be leaving school next year, and there is nothing. And when I say nothing, folks, I mean nothing. So we're very fortunate to have that. We'll just continue on. Well, we're fortunate to have it, but at the same time, the numbers are increasing, as you can see. It's gone up over the years. We're up to over, I think it's 1475 for this current fiscal year, FY25. So it goes up and up and up. So what does that mean? It means a couple of things. One, it means that people are moving into Massachusetts because we also have a very excellent special education programs within our schools. Also, they know that there is adult services that is supported by the Commonwealth, and also too, it's just better identification of folks, and individuals who are developmentally disabled are living longer as well. So but as you can see, the numbers are growing, and they continue to grow. And those include not only folks, this is DDS, those are just people who identified who are in our 2022 class for this fiscal year, but also involves folks who are not just ID, developmentally disabled, but also folks who with autism. So we include those as well. And that's where the 504 plans are coming in later. But we also fund folks because since 2014, we've accepted folks with autism. And, we're very, very fortunate to have that. So how does this work? Well, the first line says it all. It begins and ends with your school system, okay? Only the school system can submit a Chapter 688 referral. Chapter 688 referral is just a very simple document that only the school system can submit, but it identifies somebody who the special education team feels is going to need adult services when they're done with school. And what it does is it notifies an agency like DDS, or it could be Department of Mental Health. I wouldn't say MRC, but I think they just changed their name to Massability this week. Did they do it this week? Okay, it's been going on for a year. I'm waiting for it. But I heard that they were changing it, or it changed. But anyway, Maskers for the Blind, Deaf and Hard of Hearing. It lets that agency know that, we have the student, Victor, who's going to be turning 22 in a couple of years. We think he's going to need adult services. We're letting you know. Because what happened before the law was passed, initiating Chapter 688, a student will leave school and the families go around and start knocking on doors, all these agencies. They had no idea what to do, where to go. It was families who were desperate. So this law was passed, Chapter 6, it's Chapter 688 of the education law, to initiate a transition process. And it has to be done, when they're 16 to 20. I tell people, do it around 17 and a half. Why 17 and a half? Very simple. When a student turns 18, that's called age of majority. That means that unless somebody goes to court on the student's behalf and applies for guardianship, that person no longer has a guardian. That person can call their own shots. And that person can say, I'm not interested in applying to any adult agency. And that's correct. They can't. So if it's done at that age where the guardian or parent, who is the guardian, can sign off on the forms, it initiates the eligibility process for the adult agency. So that continues and that happens. So hopefully by the time the person is 18, they've been identified as being eligible for an agency like DDS. And I'm going to talk about a little bit later on what happens if they're not eligible, but at least that's done. And when you're eligible for DDS, you're eligible for life. So even if when they turn 18, and they said, you know what, I'm signing myself out of school. I'm not interested in anything. They go off, do their own thing. Believe me, they always come back. It could be 3 or 4 years from now, something happens, or they realize they need help, they need support, and they've already been found eligible years before. So we just reactivate their case. Very simple. So that's why it's important to have things done before the age of 18. And also too, there's been times when I've received calls from a family member saying, hey, Victor turned 18, he signed up out of school. He never went through eligibility for any agency. He just sits around at home all day. What can I do? And I say, well, Mrs. Hernandez, you're not Victor's guardian, so I can't talk to you. So it's very important to have this done beforehand. Like I said, it initiates the DDS eligibility process. And then when they're found eligible, we have 22 area offices across the Commonwealth. Each area office has at least one transition coordinator. What happens when somebody is found eligible for DDS through the 688 process, they're assigned an area office, and depends on what the town where you live, excuse me, and a transition coordinator. It's something that we spent a lot of time on. I'm going to tell you a little bit what happens, what that transition coordinator does. And also too, we see what other adult agencies that the person can be assisted by, from Mass Health to now Mass Ability. And also too, we start looking at what Victor's going to need when he leaves school. What kind of services. What can we budget for that? Put them in the queue that, we have somebody who's looking for a particular type of a job or whatever, and this agency can work with him, we think, and it's going to cost X amount. So at least people can start planning to work with the person and budget for the person. We also too, we do something that's called the individual transition plan. And what the Chapter 688 does, it basically does two things. It initiates the transition process to the 680 referral, and it entitles somebody to what's called the individual transition plan. That's it. Okay. People are coming from, it's a shock sometimes, I get calls from family members when, they're used to the IEP process. They're used to they're coming from that entitlement environment. And they've been in charge. They made sure that the IEP, every I is dotted and T is crossed, and on and on and on. Well, adult services are voluntary, and adult services are dependent on legislative funding. Now, I said earlier, which we have, is you have 2022 funding, which is terrific, but emergencies can happen. We just don't know what's going to happen. Your crystal ball is as clear as mine if anything's going to happen within the next year or 2 or 3. So, we tell people just to make sure that they understand that, unlike the entitlement world of special education they're coming from, that's not the case at adult services. Doesn't mean, anything to be worried about now, but just want to make sure that people are aware. Also too, with the individual transition plan, it's a very simple document. It's 2 or 3 pages long, and that's it. It's like, Victor's interested for a day, during the day, and getting a job in gardening in a nursery. Okay, DDS on his 22nd birthday will, start looking for those services to help support him in that. Victor's interested. Victor will need to learn how to take the bus when he turns 22. Okay, well, Victor will look at travel training, and that's it. So it's a very simple document. And it's another thing that I highlight to families is that, it's not like the IEP where it's pages and pages of assessments and goals and, objectives and, all of these things, all these sign-offs. It's a 2 or 3 page document. That's it. And I'll get calls from family members who will say, we met for 2 hours. we covered a lot of topics, and all I got with this, like this 3 pages, and that's it. That's all it is. So it's just really just a outline of what the special ed team, along with the family members, thinks will think that the individual will need when they're done with school. And we do like to do it at an IEP meeting, because that way all the team members are there and they can all share their thoughts on what the person will need, share their thoughts on their skill levels, and share their thoughts too on what challenges they may have, particularly if there's a particular job or interest that they have, what kind of support that the person will need during that time. So we're, that's why the transition coordinator, will make that request when they meet the family member, when the person's found eligible, is that, try and make sure that you tell the special ed team to invite me, at the next IEP, so we can do an ITP. We call it an ITP again, we're one of the largest state agencies in the Commonwealth, so we love our acronyms. But yes, Jackie probably knows. So individual transition plan, ITP, DDS, all and on and on. So we use that a lot. But it's important to make sure that the service coordinator knows. It's also important to keep the transition coordinator updated on what's going on. Let's say Victor does sign himself out at 18. Okay, well, we won't know that unless somebody tells us. Let's say Victor, for whatever reason, has to go to an out of district school. Well, we won't know that unless somebody tells us. So it's always important to keep the transition coordinator, even if there's a family issue that could affect individual, the individual might be having a difficult time with. It's good to let the transition coordinator know. You can do it by email, just so that way we just know. Otherwise, we won't know. So it's important to do that. Also, too, I mentioned the IEP. As you know, there's a new IEP process. It's been going on for a couple years now. And DESE we have a DDS has a terrific relationship with DESE. I can't extol. They've been absolutely terrific partners in many, many different things, particularly during COVID, but that's behind us now. They've included us in the development of the IEP, asked for suggestions, had us review it, which we did. And there's a stronger emphasis on transition, and stronger emphasis on assistive technology, which we'll talk about in a minute. So there's more discussion around transition during the IEP. So that's something that we were very, very excited about. Most times, the adult funding begins at their 22nd birthday. That's in our regulations. That is, I'm not going to talk too much about it, but we get monies from the federal government. They're called waivers, and I'm not going to talk to you about that really, because it'll take the rest of the day and I'll confuse even myself if I try to explain them to you. But we get money from the federal government, but they only initiate for folks who are 22 years and older, and we're under. It's within the budget, state budget, that we have to maximize our federal monies. So we don't get those monies for folks who are under 22. So anyway, that's why many times it's not just because it's called turning 22, because that's from the education law, but our funding, some of our funding comes from the federal government, begins at age 22. Okay, we talked about money. As you can see, we get roughly about $34 million a year from the legislature to those who are turning 22. And what it does is it helps to pay for any support a person may have when they leave school or maybe before a little bit, but usually when they leave school and work their way into whatever DDS adult services they need. It does a couple things. One, it just helps bridge that gap, if you will, when they leave school and enter DDS and start their services from there. It'll help apply some of the funds to the services that the special education team has identified in the individual transition plan meeting that the person will need. Because sometimes you just can't walk into a job, or if they're going to receive residential supports, they just can't just walk into a place. They need to transition in. They have to do it slowly. Introduce them to the environment, introduce them to the job, introduce them to the staff. As you know, many of the people we serve do not transition well. So they need to kind of we have to thoughtfully and carefully introduce them to their new life. And that's if you think about it for a minute, that's very challenging for anybody. If you're going to move to another town or move to another state, kind of starting all over again in a way. So, many people, typical people, neurotypical people can rationalize and work with that. But some of our folks, though, it's a big challenge. So we have to make sure they might need some additional support. They might need some additional clinical support. So that's why we have to look and see what a person needs. But also too, it helps us to contract with an agency who's going to provide those services for them, and introduces the person and introduces the dollars that can assist and support the person there. Excuse me. So, it starts when a person leaves school, turning 22. So those services can start in November, January, March, whenever the person leaves school. So that's why $30 million sounds like a lot, but it really, there's a lot of challenging folks out there. So, we try and have it so that way, everybody gets something, immediately. May not be what the vision that people want or anticipate, but continuing to meet with the transition coordinator in the area office to, meet the vision that, most folks have. What it also does is also identifies their full-time costs. So even though a person might be turning 22 this year, FY25, let's say they fortunately turn 22 December 31st and they start work, January 1st, well, half their costs. But when we budget, we have to budget for the entire year for the following year. So this helps identifies what we're going to need for the following year, full time for the person. And I don't want to spend too much on the budget, but it's important, as you know. And we've been very fortunate again that, receive support for the legislature to make sure that not only our first year turning 22 money is there, but also to what we call annualized, the entire year's money is there as well, or, as much as they can. So we're very fortunate to have that. And I can't emphasize enough. Most states do not do that. Okay, so we're very fortunate to have that. And it may not be everything. It may not be everything that people want. It may not be everything that people envision for their loved one. We know that. We'll continue to partner and work with you on that. But at the same time, we feel very lucky that we're here in Massachusetts and we have that support. So, and oh, by the way, the numbers keep going up and up, as you can see. We've already worked on next year's money. We're because there's more people coming in. So, we're already working on trying to meet that and match that for the upcoming year. Okay, like I mentioned, the school systems initiate this process. And again, it said only the school system can do this. You can't do it. I can't do it. If they go to a out-of-district day school, they can't do it. Or if they're in a residential school, they can't do it. Only the school system can do the 688. So that's why it's important. when you go to the IEP meeting this year, and your loved one is, I would say 14 years and older, all the school systems know this, but it's good to start talking about, the transition plan, and you don't want to do it too early. And I'll tell you why in a minute. But it's just good to just put on the table, on the radar for, the following year or two or whatever, start talking about filing the 688 and which agency you think or the team feels that the 688 should go to. Again, it could go to DDS or Department of Mental Health or another agency. I'm going to take a water break. Thank you. I guess I mentioned a few seconds ago about filing too early. It's because somebody could send out, oh, get it off immediately. Well, the person's 14, we'll do the 6-8 referral. Well, that initiates adult eligibility. So, and we really don't do adult eligibility until the person's around 17 and a half. So it could be like a 2 or 3 year gap there. And the person, you can move, person may change schools, go to an out-of-district school placement, be residentially placed, whatever. So we really can't do the eligibility then. And plus, Victor at 14 could be a totally different person at Victor at 17. So that's why it's just good to put it into people's ears, and also to let the school systems know that you're aware of 688, and then you have an interest in it and something you're going to follow through on it. So I think that it's good to at least put the bug in people's ears. You start, when they're on 14 or 15, that the next IEP meeting or 2 IEP meetings from now, at the next reeval, we will want to talk about the 680 referral and which agency we think that they should go to. And also too, this is just the forms now, which is terrific, are done electronically. They used to be done a paper form, and they used to be mailed, and you can imagine what it's like when you mail forms. And again, thousands come in to all the agencies every year, 6-8 referrals. Okay, you can imagine all those individuals who are entering transition age, and people do the 6-8 referrals for them. So thousands come in. So you can imagine what it was like when they were done by mail. So they're done electronically, and it's a good thing to excuse me, mention that. Most school systems do it, but there are some that will still do the paper referral, and paper referrals are not accepted. So all that's doing is delaying this entire process. You during the IEP and the initiation of the 688, it's part of the IEP, so it's discussed with you, you sign off on it, everything like that. So you're aware that a 688 is going to be filed and all this good stuff. But if you have a question, particularly if you said, gee, we'd like DDS to get, Victor's 688 referral, and it's been a year or 6 months, you wonder, gee, was that ever filed? Just send an email, send us a note, because we all do, and I do, have access to, the area offices has access to all of those who are DDS that a 688 referral was filed for. I have access to all the 688, so I can say, yes, it was filed, but it was filed to another agency, so it's good to know, just if you need that check, just to make sure that if the 688 was filed. Okay. Folks with autism, since 2014, through the Autism Omnibus Bill, we changed the eligibility to find folks with autism under certain guidelines eligible for DDS services. A hallmark decision, something we worked on for a couple of years. many stakeholders and advocacy groups out there were very helpful in this process. You know, I would do these workshops for folks, in person of loved ones who will be leaving school, and some of them were families of individuals with autism, but yet they weren't eligible for DDS, and you can just see just their eyes that it's just, what are we going to do? What are we going to do? Fortunately, we were able to work with a lot of stakeholders. Stakeholders were terrific in this process, including first and foremost the ARC, and legislators, and also other agencies that support DDS as well. So we found able to pass this. For the first time in the history of the Commonwealth, people with autism had a place in state government. Before that, they didn't. So we're very, very fortunate to have that. And 3 years later, in 2017, we started to include people with autism, more formally in 2018, but starting in 2017. We're turning 22. So they're a part of the funding process as well. For a lot of reasons. Why should they be left out? I mean, they are graduating and they need transition supports as well. Also, to the numbers. In 2017, about 1 out of every 5 or 1 out of every 6 of the turning 22 class was somebody with autism. This year, it's less than 1 out of every 3. I think it's 1 out of every 2.7. Actually, in the turning 22 class is somebody with autism. So the numbers are growing, and they don't get everything because of the way the funding is, or the services are for folks with autism, autism only, but they receive something to help support them with their interests, so we're able to do that. But many folks with autism don't have a special ed plan. Many have a 504 plan. And the law for Chapter 688 mentions folks within the law, applies with people with special education. But it doesn't mention 504 because in 1985, it wasn't an issue when they did the Chapter 688 law. So Victor just said, well, they just need a 504 plan, we'll do it. I'm not going to get in. Why should they suffer? Why should they have to be left out? So, folks who with autism may not have a special ed plan, but are on a 504 plan, at least they still need some accommodation. They still need some assistance. So that is kind of like the sneaky key, if you will, to include them for the turning 22 funding. But they don't get a 680 referral because for 688, you have to have a special education plan. So it's tricky. It's not that they're not in the that electronic system that I mentioned, because they don't have a special ed plan, and you don't have a special ed plan, you don't get a 688 referral. But what we do there is, when they're found eligible, it's called Autism Only, that notifies the area office. Okay, Victor is somebody who was found DDS eligible under the autism regulations, and he may or may not have a special ed plan. But at least then the area office can start to investigate and look into it and find out if Victor has a 504 plan or what does he need. I mean, he may even have a special ed plan. I'm not saying he doesn't, but it gives us the opportunity to do that. Also, to remember, when the person's found eligible, you're going to find out which area office your loved one is tied to, and you're going to find out who their service coordinator is. So you can also contact that person saying, hey, my loved one, Victor, was found DDS eligible. He has autism. And I want to know, just to make sure, is he in the queue for 2022 funding and things like that, and start working on that aspect as well. I keep mentioning one thing that I always highlight to families is that you still have to do a lot of work here. Okay, we partner with you, but, and I tell families this, if the 2022 process is going to work, you're going to be a part to make it work. Okay, I mean, you have to still have to follow up, because again, we have transition service coordinators in each area office. They may have a caseload of 150 people, if not more. So that's why it's always good to keep them updated, ask them questions, invite them to the meetings, things like that. So it's very, very important. And it's a lot going on at that time. The person is 18, 19, a lot going on with them, a lot going on with the school, a lot going on in your own personal lives. It's a lot happening there. So it's very important to keep track of all these things as well. It can be, and if there's other siblings, a lot going on in their lives too. We know that, we understand that. So, we try and partner with you as much as possible in all of these things. Central office, we have a team there that works with all the regional offices for Turning 22 and the Autism Service Coordinators. I meet with them on a quarterly basis. We talk about things that are going on. I highlight some things that may be happening or may not. For instance, one is make sure that they're aware that the MCAS is up for a vote this year, ballot number 2, in terms of the elimination of MCAS or keeping it. So what could that mean? What could it mean? We don't know, but we have to think about those things and we have to be prepared. And so we talk about a lot of different situations, a lot of things like that. Also to work closely with DESE. And again, I can't emphasize what great partners they are. We've great working relationship. We also work with the other EOHHS agencies, on the needs of individuals and what can we collaborate on? Department of Mental Health, we have some programs that we work together on, massability. So we do a lot of those things like that. We just talked about your child's life in about 40 minutes. That's pretty good. Yeah, I've done 2-hour presentations on these things. There's my contact information. That's who I am. That's my desk phone. I can assure you I'll never be there. That's why it's important to email me, or there's my information there if you need to send me something in the mail. Also too, we have many different social media platforms. I encourage people to check in on that because we update them, let them know what's going on with DDS, planning, initiatives, programs. I mean, I didn't even talk about our eligibility process, what's involved in that. I didn't talk about our priority process that we're rolling out. So a lot of things here. This is a very high level presentation, but if you go on the DDS website and you see the link right on the bottom, that has all of those things. I can assure many of the questions you have are in there. Now, it's not a DDS. We didn't develop this website. The Commonwealth has a website that we're a part of. So I have to say wonderful things about it, but I can also say that it's not the most user-friendly website as well. It's a lot of click involved, but we do the best with what we have to work with. So, I don't know if any questions have come in. I'm sure they have.
You do have questions.
I bet you do. But, I'd be happy to answer them until time is up. I'm going to get a drink of water first. Why don't you go ahead, Jackie?
Okay. We do have some questions, so we'll try to go through them quickly in the time we have left. Roberta asks, what services support should the transition coordinator be providing or offering to kiddos in residential schools, especially on those kids who are close to aging out?
Yeah, well, we try and start, again, it depends on a lot of different things, but, we try and start early enough so that way we can find out about the person, particularly in a residential school. what kind of supports they're going to need when they leave residential school. What's the clinical needs of the person? Any forensic issues there, things that we need to know about. Where we need to place them, what's available. Again, try buying a house these days. Okay, so it'd be great to find a house in your neighborhood. It'd be great to find a house in your town, but that house might be 10 or 20 miles away. That's where you have the location. So all of those things to start to work with on, so all those things to try and start what the needs are. Attend the IEP meetings, attend the transition plan, work with the residential staff. How's this person do? Did he transition well? Do you need to do 2 or 3 overnights, or do we need to do 2 or 3 weeks of overnights? All of those things. We've done this hundreds, if not thousands of times by now. And I can assure you, no 2 cases are alike. So that's how we treat it. That, what is Victor all about? What are your needs as well? And see what we can do. But, it could be a lot of dotted lines, not necessarily a lot of straight lines, but we do try and make it work as best as possible.
And Dawn wants to know, do adult services begin sooner if the child graduates? Some kids will graduate at 18, they don't do the extended.
We try to support the person. I can't necessarily give you adult services, but we do try and support the person and find supports as best we can. A lot of it too has to do with the geography. The geography in Metro Boston is a lot different than the geography in northwestern Massachusetts. Might not be a lot available within a short distance. There might not be any transportation, public transportation available at all. So we try and look at the whole situation and what the family's needs as well. When we prioritize somebody for services, we also look at the caregiver and what caregiver supports are there and what the family life is like as well. But we do try and provide some level of supports for people. May not be everything they want, may not be the adult services they want, or we can provide at the time, but we try and meet the needs of the person as best we can. Many times when somebody leaves school before they're 22, they've graduated. So they have so many capabilities that they just might need a little bit of support to find their job that they want. I mean that's a very simplistic approach, I know, but that's why I said, we try and look at each person individually. So, yeah, we try and do what we can.
Kendra writes, I'm a family support specialist and am getting cases where students are DDS child eligible and the school district did not submit a 688 referral for ASD only cases and student graduates at 18. DDS has said they don't have funds for these individuals and cannot support them until they're 22. What can we do as family support specialists to help these individuals?
Okay. Well, they're not going to get a 688 referral because they're autism only, and we know that. And we mentioned earlier that many of the funds aren't available to their 22, but there are other things involved, other things available as well. What mass health supports are there? What state plan services are there? From counseling to some employment that might be out there. What is the person capable of? Is Job Corps something that they can be involved with? It's so these are all the good questions to ask the area office and the transition coordinator, because they know what types of services like those, community supports, things like that, are available in the town. It's just somebody who could just benefit from a voc eval for mass ability. Used to be mass rehab, could be a voc eval. I mean, it's not just DDS. There's so much out there, and that's what we know. So, if there's somebody coming down the pipeline, and again, I know what it's like. You don't know until the what hits the fan, and you get the call that this is crashing and burning around us. But if there's some time and somebody's coming down the pipeline in these situations, encourage the family to, check in with DDS and there may not be something available at that time. That is a reality. Okay, but let's see what we can do in order to be able to help fill some of those gaps. And we're going to continue to have to do that until something else is available. And, so sometimes it is band-aiding, but at the same time, initiate that discussion now.
Great. So Doug asks, how do I handle the 688 referral if my son is currently homeschooled?
Oh, good question. I get 2 of those a year. And, one, make sure the area office knows that your son is being homeschooled, okay? Even if, you backtrack a bit. Anybody can apply to DDS, okay? You just don't have to um, uh, enter DDS to the 688 system. Anybody can apply at any time to DDS. So it could even be something as, you know what, my son is being homeschooled. I'm making this up, okay? But my son is being homeschooled. I'm still working with the school system in doing the 688, but I want to initiate the eligibility process now. Okay, you're not going to bump anything off. If you initiate the eligibility, it's not going to bump off the 688. It's that that won't happen. Okay, but at least it gets that process going, and it can alert the area office that, hey, this Victor is applying to DDS, is being homeschooled, and the dad's trying to get the school system to do the 688. So, maybe we can make some calls too. You can do both at the same time, but before I was with DDS, I worked many years in the private sector, private schools, Massachusetts and my home state of California. And one thing I do know is that there's nobody more tenacious than the parent of a special ed child. Okay? I know that even if it means you have to sit in that lobby for 4 hours to see that SPED director, you're going to do it. If it means they get the call, you're going to do it. So sometimes you just have to find out what the deal is and get it done. That part, because remember, again, only the LEA can file the 688. So you need that to happen. So you, special ed parent, what are you going to do about it? You know the answer to that, and so do I. But at the same time, you can initiate the DDS eligibility process during that time. It won't affect the 688 process. And you can, just let them know what's going on. You're trying to get the 688 filed. But that's, so that's a good question. That comes up about once or twice a year, even for the area offices too. But as long as we know, we can try and work around that as well. That's why it's good to let us know. That's a good question. I'm glad you asked that.
So we are running, we've got about 10 minutes left. I want to quickly cover some of these. So there are 2 questions related to the role of the DDS coordinators. Should they be involved with the individual transition plan? Are they expected to attend the IEP transition meetings? And what can families do to make this happen if a region doesn't seem to have a transition coordinator, a DDS transition coordinator, which I thought you said every region has one. So,
Every area office has
but
one.
what is the expectation for the
Okay.
role of
Sure.
these
Well,
coordinators?
one, the transition coordinator is the person who writes the individual transition plan. Okay, they write the ITP. So therefore, they have to be at the meeting because they have to conduct the meeting. Sometimes it's done remotely, depends on the situation. There's a lot of things in between, but essentially, the transition coordinator has to conduct the meeting and write the ITP, and they send it to me. Okay, we sign off on every ITP. Okay, and try and get that arranged. And I'd say about a year before they leave school, a year and a half before they leave school. Timing wise, sometimes it doesn't work. Sometimes it's only at 8 months before they leave school, but essentially that's what the coordinator does. Every area office has at least one, and there's also a person at the regional office. There's 4 regions who oversees the folks and within their region, all the areas, and they work with them on 2022 issues. And me, the central office person, oversee everybody, all the area offices and regions. So that's why we meet quarterly. We talk about these things and issues coming up. Did I answer the question?
I think so. Are you looking
Okay.
for more clarification there? How can a guardian apply on behalf of a 26-year-old who meets criteria?
Can you ask that again? I'm sorry.
This is from Cheryl. How can a guardian
Oh.
apply on behalf of a 26-year-old who meets criteria?
Okay, they can apply for DDS services. The guardian can. It's on the website, and it's I think it's called How to Apply for Eligibility or How to Apply for Services. They're too old. So in other words, they won't be available for 2022 or 2022 funding. But as I mentioned earlier, anybody at any time can apply to DDS. So we have folks applying at 28. We have folks who the parents have always kept them at home and the parents pass away. And the brother and sister now are caring for Victor, and Victor's 48 and they need some support and they're applying to DDS then. So we get them at all ages. But I mean, anybody can apply to DDS. So if you're the guardian, the information is there on the website on how to apply and where to apply. You know, since you're the guardian, you can start to initiate the process.
So we had a couple of questions about transportation. I don't know if this is an area you would know about. Does DDS help with?
You know, when you work for the Commonwealth, you wear about, I don't know, 6 or 7 different hats and only about 3 or 4 fit. Well, one of the hats I wear as well is transportation.
All right, so 2 quickies. Does,
Nothing's quick about transportation, but go ahead.
does DDS help with transportation to attend a community college?
That also that it involves there's a higher ed bill that's been passed. I've been lucky enough being named as co-chair of the implementation of the higher ed bill that I work with. That's what happens when you hang around too long. People give you things to do. It's terrific. I have a very excellent relationship with Mary Price, Department of Higher Ed. She and I co-chair the ramp up and rollout of this higher ed legislation. Through that, DDS transports, well, the transportation works when you go to a contracted service. So community college or college on a contracted service, but through some things like family support, maybe able to provide some reimbursement. We work with Uber and Lyft. They have special programs for our folks. So there is some way of providing some type of support. We may not do the transportation that's what you're looking for, but see what options are there. And that's where it's really good to ask your service coordinator. And everybody in DDS services has what's called an individual service plan, support plan, ISP. And those are the things that you put into the goal in an ISP. You know, we want Victor to be able to go to college next year, and we need to work out some type of transportation.
So the other transportation one I think is regarding adult programming. Would DDS help with transportation to adult programming?
We when somebody starts an adult program, the service coordinator will put in a transportation request. Transportation for adult services is not a DDS function. It's function of the Executive Office of Health and Human Services. We're a bureaucracy, folks. What can I say? And part of that was a service called Human Service Transportation, and they do all the transportation for DDS. It's a multi-million-dollar project, but essentially the service coordinator will say, Victor's going to start a program November 1st. What is out there for him? And then they try to see where there's an availability and all that good stuff. But again, when it comes to case management, when it comes to services, the rubber meets the road at the area office and with the service coordinator.
Great. And then Diane just wanted to mention the 688 follow-up is very important. Don't assume the school took care of it. And I think, Victor, you've been speaking to this. get confirmation, ask about it, because that is where it starts to happen. That's the
And
process.
again, if the school doesn't file it, we don't know. And if we don't know, we don't put those dollar signs next to Victor's name.
Right.
How's that? Does that get you going?
And Victor, you did mention about other agencies that can provide support. And so we had a question about DDS and massability, let's say. And I'm just wondering, the person asked, if that starts during the 688 referral process, when the school is looking at what are some agencies, could you be right in the beginning of that transition process, somebody who's, they're saying, this person would benefit from DDS and massability, or is that something you choose one primary agency at that point, and then the other agencies can be add-ons? How would you
Well,
look at that?
the 688 can only file to one agency.
Okay.
That's the way it's set up. But it doesn't mean that during the ITP meeting, it's also decided, Victor can use some of MRC, massability services like a VoCeVal, and it's written up in the individual transition plan that, VoCeVal, massability. And that way the transition coordinator can start to work on that before Victor graduates or when Victor graduates. Or Victor might need some clinical support from the Department of Mental Health. So see what community mental health services are there as well. We all do talk to each other. We're all big agencies. We all do talk to each other, particularly in the area offices. Some even meet quarterly, all of them. The children and families, deaf and hard of hearing, they meet, so they talk about cases as well, because many times we're all in the same building as well in the area offices. So
Right.
yes, I mean,
And obviously it's important for families to know too, that they can ask for these things and
yes,
look for that.
absolutely.
So I want to be respectful of everybody's time. Victor, thank you so much. I'd like to thank you, our sponsors again, as well as special thanks to you in giving us your time to make this presentation, and attendees for spending their precious time with us. So thank you all. We will be, as I said, we recorded the meeting. We'll be sending everybody a copy of the presentation, as well as you'll have access to the YouTube channel to see the recording. So thank you all and have a great day.
You too. Thank you.
Bye.